Hello out there in the virtual world. My name is Jordan Person, and I am our staff nurse and one of our senior staff writers. We have brought our publication, Grassroots America Magazine, to life. And today I have with me the amazing Dr. Janice Knox. She's a board certified anesthesiologist and an endocannabinologist. Thank you so much for being here today, Dr. Knox.
Thank you for having me. I'm
Absolutely.
excited.
We're excited to have you. I was explaining before we started our video that I'm fangirling pretty hard out there to our listeners. So Dr. Knox, can you start by telling us a little bit about your background?
Okay, of course. Well, I was born and raised in San Francisco, California. I'm the fourth of 15 children and grew up in a very religious family. And I tell you that to sort of set the background. Fast forward to my college days where I went to school at University of California, Berkeley. And that becomes important because everybody understands the student culture at Berkeley. A big part of it was drugs, right? Which marijuana was a big part of that culture. Well, I never saw the plant. I didn't know anybody who used it. I couldn't have explained a thing to you about it. And I attribute that to that very religious background that I grew up into. So I didn't know a thing about cannabis. And fast forward 30 years when I became an anesthesiologist and getting ready to leave that field, I was invited to do one of the card clinics where you sit down with a patient for 10 minutes or so and you say, yes, they qualify for a state issue medical marijuana card. Well, my first day in there, I knew who I was going to see, you know, the hippie-like, you know, Rastafarian with, you know, a joint hanging out their mouth. They only wanted my precious signature. So I just knew that's what I was going to see. So in spite of all my reservations, I did go because I had reservations about why would I want to do this? But when I went, who I saw walk through that door blew my mind because who I thought I was going to see, that's not who came in. People who looked like you and I, businessmen, retired policemen, grandmothers and grandfathers, you know, people bringing their babies in and their teenagers in. And I was shocked. I mean, I was totally stunned. And some of these people were spending their last monies to get this card. But what's most important was that they were looking for a clinician, because some of them are still kind of on the fence, looking for a clinician who could help them, who wouldn't judge them. And these are people who had failed conventional medicine or conventional medicine had failed them. Well, I had already judged them because I knew what they were going to look like. But the other part is I still didn't know anything about cannabis. Nothing. So all I was delivering was just a signature. And being that kind of anesthesiologist, I felt like I needed to give them more. So I went to study and see why they wanted this plant. And when I found out the medicinal benefits, the next question became, then why did it get kicked off the American Pharmacopoeia? So I went to the congressional records and started reading up on how they got rid of hemp. And I was angry. I felt cheated as a consumer, and I felt cheated as a physician, because none of it was based on science or research. It was the industrialists, ideologues, and politicians. So I went a step further. And okay, so this is a plant, it has medicinal benefits. How does it work? And when I found the physiology and finally understood that this wasn't about cannabis, it was really about that physiology in our bodies called the endocannabinoid system, now a bigger picture called the endocannabinoidome. We decided as a family, I'm one of 4 doctors. I'm Dr. Mom. There's a Dr. Dad, and then a Dr. Rachel and Dr. Jessica. We have determined that we are endocannabinologists because we believe in addressing that science, which cannabis happens to be the most versatile tool that controls that physiology, that can control or modulate it. But there's other botanicals as well. So that's how we came about being endocannabinologists. That's how I got into the space, just doing my own research and digging in deeper and understanding that I had been cheated as a clinician and as a consumer, because my mother died with breast cancer. I lost a first child to anoxic brain damage. And I can tell you that perhaps this plant would have helped them, but I'll never know because I wasn't given that opportunity.
Right. Wow. So much passion. So you mentioned 15 children that you
Yes.
are one of, and 4 of you are in this clinic that you've created. Is the clinic in California?
Well, no, no. The four of us is the two daughters and my husband. I was one of 15 children.
Okay.
And my family's in California. I'm in Oregon right now.
Okay.
But my two daughters went to medical school, of course, decades after we did, but certainly in time enough for them to learn about that physiology, and they didn't learn about it either. So as my husband and I were getting into it, the girls decided that they weren't going to do conventional medicine. They're going to work with us. And we do majority telemedicine. We do have one brick and mortar clinic, but we see patients from across the United States and globally when they can't find a provider who knows anything, number one, but who will listen to them without judging them and making them feel like they're drug addicts or criminals, or, or telling them there's not enough science or research, because that's usually what they get. And so we have put ourselves out there, not only for patients, but other healthcare practitioners, and we don't really care what the initials are behind their name: MD, naturopathic doctor, Chinese medicine, we don't care. We just think if this tool is out there to be used and patients are going to look for us and they're going to ask, we have to be able to respond in an intelligent way.
Absolutely. You are at the forefront of what all physicians need to have a general base knowledge. I mean, I've talked to so many physicians that remind me that you are all not taught about this in medical school. Even
No.
still, it's not part of the curricula. And so it boggles my mind. Here we have 33 medical states, 11, 13 recreational, with 4 or 5 more on the ballot for November. And yet we're still having this
Struggling.
battle all the time.
Yeah, yeah.
So can you explain a little bit more, what exactly do you do as an endocannabinoid?
Endocannabinologist.
Thank you.
So what we do, we really believe, and we push this first, that it's all about the physiology and then the correct application of the pharmacology of that cannabis plant to that physiology as it addresses it in different disease processes. And everything we talk about is based on the science and the research. And this research is constantly showing us new things. And also, more and more about what's in that cannabis plant that applies. But the reason why it's so important to understand that it's about the physiology, which all of us have this very amazing physiology. It's an ancient physiology, always been with us. What we need to understand that it's unique to each of us. Our own physiology is unique to us as are our fingerprints. So no two people have the same endocannabinoid foundation or tone or health, as we like to call it. So we as endocannabinologists base everything we do on understanding that physiology and then looking for the correct application of cannabis or any other botanical or what we call a cannabimimetic practice, like acupuncture, massage therapy, or cupping, any of those things, meditation, that will move that endocannabinoid system back toward health. So we don't focus just on cannabis, we focus on the tools that can be used to modulate that endocannabinoid system. So it's a study of the endocannabinologist. So we're practitioners and students because we're continuing to learn about this amazing physiology.
I love that you just said "and students," because isn't that what we all are, that are trying to understand this plant more
Yeah,
and better every day? Forever students.
yeah.
Dr. Knox, if you could provide some advice to providers that might be listening right now, any fellow physicians or nurses or anyone in the medical industry that wants to become involved in this
Mhm.
industry, what would be your advice for them?
So number one, I think education is the key. And this space is something to be excited about. I mean, it's like putting a puzzle together. It finally explains why botanical medicine works, whether it's Ayurvedic or Chinese or Native American, but it also explains why some of the cannabimimetic practices work, like acupuncture and massage therapy or osteopathic manipulation and meditation. It really is the linking between body, mind, and spirit. And we need to be able to bring that back together for our patients. This is an exciting space. It gives us a chance to not only understand why things work, but to create other practices and services to get people to wellness, not sickness. We need to do everything we can to prevent people from getting sick. And the more we understand, and clinicians you understand, then you help people to stay well instead of getting sick and trying to drag them back. So my advice to providers is to get involved. We should be at the forefront of this, not pharmaceutical companies, not insurance companies, not big business, but you clinicians of all types should be at the forefront. Let's tell them what we want for ourselves and our patients, our communities, everybody, because we know best. Not the pharmaceutical company, not big business, not insurance. So that's what I want. I want our organization to get excited about this. This gives us a chance to step up and be who our patients want us to be. They still want to believe in us. Let's help them, right? Let's help them.
Absolutely. I was wooing in my head the whole time you were talking. Didn't want to interrupt you. And I have one more question for you today, Dr. Knox.
Yeah.
What would be your advice for patients? We have so many new medical cannabis patients either
Yeah.
trying to get their cards, some are still even being medical cannabis refugees like I was a decade ago, leaving my home to go somewhere where the plant was available. So what is your advice to those individuals?
We still see a lot of barriers for patients themselves, but I think all of this is going to be driven by the patient, particularly those who feel like they have been failed by the conventional system and they're angry because of it. My advice to them is to get out there, talk to your neighbors, your family members, your friends, your community, understand enough about your health, reclaim your health, and then look for the most natural products to address your health. No longer can you sort of hand over your health to even your providers, certainly not the big pharmaceutical companies. We need to own our health, own your health, and understand that every part of you, your spirituality, every part of you is important. And that's your job. And then try to understand the most natural products out there to help you return to wellness. Or if you're sick, to bring you back to wellness. All of us should be striving to be well or to stay well. And to me, if I can get my patients to understand this is their job, their health belongs to them, not to me, not to, once again, pharmaceutical companies, then we can move them forward on this track. And I tell them, the further you get away from natural, the more problems you're going to have with medications. The further you get away from natural products, the more complications you're going to see. So let's bring this back, to what the universe has given us, the plant, the earth, the air, all those things. Let's put them back where they belong to help us stay healthy, right?
Absolutely. Yes. You're talking to a organic vegetarian of 27 years over here. So yes, whole plant lifestyle, organic products at large. Dr. Knox, this has been so incredibly informative. I feel like I could talk to you forever. Thank you so much for your time. I greatly appreciate it. If anyone wants to learn more about Dr. Knox and her amazing family, their link will be below. Thank you so much for tuning in. Have a beautiful day.